Welcome to the Dr. Ramsey Show, sponsored by Revitalize Functional Medicine. If you're looking for health tips released consistently every week, you've showed up to the right place. We're grateful that you're joining us, and now your host, Dr. Teresa Ramsey.
Hi, and welcome back to the Dr. Ramsey Show. Today I have a woman here sharing her experience taking hormones after she was diagnosed with breast cancer and what she went through with that. I want to introduce to you my friend, Peggy Burton. Thank you for joining us, Peggy.
Thank you. Thanks for inviting me. It's an honor to be here.
And you know, we've been together so long, the details of what we're going to talk about, I forgot. All I remember is that before you met me, you did have breast cancer. You were very worried about it. And then as we were talking before, you were sharing that prior to your breast cancer, you had met a doctor that put you on some hormones, right?
Right.
And it was a year later that you were diagnosed?
It was about probably 8 months to a year, but the hormones were not successful in terms of trying to maintain levels because I was having extreme hot flashes and I was not sleeping, and so it didn't work, which I always believed was why I got breast cancer, but you just said it takes 8 years to get it.
Yeah, if a woman was diagnosed with breast cancer, it didn't just show up in the last 8 months. It's been growing for 8 years, and at the 8-year point is when you can see a tumor on the breast.
Okay.
Yeah. So yeah, that didn't contribute to it. Although the treatment wasn't successful for you, when you were diagnosed with breast cancer, they did take you off of them.
Right, they did, and I swore I would never go back on them. I was really struggling with it, and I was recommended to you through a friend. And when I came in, I remember you saying to me, we did a genomics test at the time, and you said when you got the results back that you were shocked because they were so bad. And you said to the consultant when you were reviewing my report that if she walked in, I would think all I had to do was toss her an aspirin and she would be just fine. I have a great ability to cover up. I always have. Yeah. No one will know that I'm sick because I don't want them to know that.
Right.
But I was really cracking inside, and I knew it. And so just your demeanor, your professionalism, your ability to make me see how important it was to try it. You saved my life. That's why I went on them, was because of you. And we've had a few bumps along the road because I have a very challenging
system.
A very challenging system, but she never gave up. She stayed with me, and we got it. I feel like today I'm where I need to be, and if it's not broken, why fix it? It's working, and I really do attribute it to you.
Right. And I know early on, this is before you met me, one of the breast cancer surgeons or oncologists said, if you're going to take hormones, I won't treat you.
Yes. Yeah. It was the surgeon. I had, we're from Illinois, so we're snowbirds. And I had, my first lumpectomy was done in Chicago, and I was on them at the time, hadn't been on them long, as I told you. And he said, I'm going to tell you right now, if you're going to stay on these, that I'm not going to treat you. And so he didn't, because I walked away.
So this was when you knew me then?
No, I didn't know you yet.
Oh, yeah.
This was when I was first diagnosed, and I just didn't like the demeanor. It was my choice if I wanted to be on them. I didn't want to be. I wasn't going to stay on them because I ended up with breast cancer. But by the time I met you, I had spiraled down even with the breast cancer. And I say today, I have my oncologist that I still work with, who's become a really good friend, who is so against my bioidentical hormones. But she has come to respect it, and she will say to me, I don't like it. And I said, I know, and I appreciate that, and I respect you for your opinion. You have to respect me for mine, because they have changed my life. I said, they've saved my life. If somebody told me today that I have to go off of them, I would just as soon die, because I can't function without them.
Yeah, I can't either.
They're that important to me, and I really do believe it. And I believe you because you have told me this since the day I met you, how important they are and how it will help me sustain my quality of life to an optimal level. And that's what I'm looking for.
Right, right. Yeah, what Peggy's talking about, we can age normally. It's the way people age who don't take hormones, or we can age optimally. And the reason we use that word is because as we age, our hormone levels should really decline to zero, pretty much for women. And then we're living the second half of our life with no hormones. And when we live without hormones, our cell turnover is very compromised. And that's when we look at what's your genetic risks, is now we're going to express them because we don't have something keeping our genes strong. And I know oncologists don't like their patients to be on hormones, especially estrogen. And the reason is that there is this belief, and it's very strong in the oncology world, that if you have a breast cancer that's estrogen receptor positive, estrogen caused it. Okay, why don't all young women who have really high estrogen levels don't get breast cancer? Like, that logically doesn't make sense. And the research even shows women who took Premarin had a very low risk of breast cancer compared to women who didn't. I don't prescribe Premarin, but estradiol, which is our bioidentical hormone, women who take it have a lower risk of breast cancer than women who don't. The hormones that were risky in all the studies, unfortunately, were the synthetic progestin, like in Provera or Prempro, but research isn't separated that way for lay people. Right. But when we study the research with my teacher, Neil Rousier, we see the difference in what arm of each study was the risky one. It never was bioidentical estradiol. It's never bioidentical progesterone. Not one study to date, which is beautiful.
Right.
Right. And if we do get breast cancer on hormones, it's going to be the lowest Gleason score, the easiest one to treat, because we can't take away the risks. We reduce them. And yes, some patients will get breast cancer and some patients don't, but I know that our outcomes on bioidenticals is going to be much better than without. Just like you feel. Overall, your head to toe health feels so much better with them.
Right. Well, my gynecologist, I had a Pap test right before we came out this year in Illinois. And he said to me, I just got back from a conference, and he said they talked again about these hormones, how they're just not good for you. And I said, Jeff, but that's synthetic hormones. And he said, yes, it is. And he said, but Peg, I'm going to tell you, I've seen you for years. And he said, so when they're up there and they're talking about this, I'm saying to myself, but I have a patient, Peg. And he said, you're probably one of the few that I have that's on bioidentical hormones. She does fabulous. Mm-hmm. So, I think everyone's different. You have to do what you're comfortable with and what you believe in, because that's part of it. And I believe in it.
And I want to make sure, too, when you talk about in the beginning, I want to make sure that you felt I was educating you, not pushing you.
Oh, no, you were not pushing me. Okay. No, it was the level of education. It was the level of your confidence. It was the level of your experience with your patients that you had. No, you never pushed me at all. Not at all.
Well, you said I wasn't sure.
No.
I do push ones I love, though. I didn't know you well enough to push you.
No, you didn't push me. But there's been times I probably needed a gentle nudge, but no.
Yes, because I do remember you getting a little nervous before your mammograms.
Right.
Since you've been on the hormones. Do you still get nervous?
Sure, I do. And there's been a couple of scares, but as you live, I think that's part of life, and I've always been able to push through them. So, yeah, I don't think that's abnormal for any woman that goes in for a mammogram that says, "Oh gosh, I hope they don't find anything this time." But so far,
I used to be that way. I just don't do mammograms anymore, and the reason is when I did my last mammogram, it was in 2015, and I've been with the same radiographer. She's retired now, but anyway, she would sit with me and go over my films with me. And in 2015, she said, "What are you doing?" And I had increased my estrogen, so I thought she saw something on my breast. She says, no, quite the opposite. There's nothing on your breast to look at. She showed me all my previous films. And she's taking notes, and she said, whatever you're doing, keep doing it. And I developed such breast confidence at that time. that I decided if my breasts are that clean and I'm still taking the same stuff, maybe I'll do one in 20 years just to see. But I have such breast confidence now. And I know that the hormones I take have given me that, because my first breast biopsy was at the age of 18.
Oh, wow.
And, you know, when you have a biopsy in your breast at 18, you're left with this question, when? And I did, as a nurse, until I learned functional medicine. I says, wait a minute, I don't have to express that gene. And here I am, 56 years old, with really healthy breast tissue, et cetera.
Yeah, that's great. Well, I have very dense breasts, and I do have fibroid tumors, so they do follow them.
Which are benign.
So, right, they are benign. Nothing is alarming. But for that reason, and because I've had breast cancer, I continue to go and have them. I wish I didn't have to, because the left breast has become so hard.
Yeah.
Just from where they did the radiation. But I at this point, it's one of those decisions, again, that you make, and I weigh the options, and for me, I feel like I need to do it.
Yeah, of course. And that's what you just said. We all have to do what feels good for us. You know, the power of the mind is really important. So if you were taking these hormones every day and wondering if it's safe, that's going to cause an issue, because our mind is more powerful than anything in our body. So that's why we have to make sure our thoughts are aligned with well-being, especially when we take our support each day.
Exactly.
And then your husband, Don, he comes here too.
Yes.
And he's doing really well. I see him once a year.
Yes, he's doing great. He loves you.
Gosh, he's active and he's hiking.
He will follow your directions over mine any day.
Thank God we're on the same page, right?
Yeah, exactly. No, he's doing really well. And he, likes to have his blood work checked and maintained. And you've got him on testosterone and some other supplements. And I think he's doing really well.
And he's really active at his age, He is. And I think he appreciates the hormones for that, because it keeps us going.
He is. He is very active. In fact, he was up this morning hiking at 5:30. But when I left to come down here, he was in bed sleeping again.
He's back home in bed.
Yeah, so he's back home. He's back home in bed. But anyway, no, I really want to say to women, don't be afraid of the bioidentical hormones. I really, truly believe in my heart. I mean, I've been on them now for probably 12 to 14 years. And I've tried going off of them periodically, just to see, well, is my body adjusted that maybe I don't need them as much? And I can't. I notice immediately that I need them. And I believe, because you've told me this, and my body has proven it to be true, that I will be on them for the rest of my life.
People ask me that, like, how long? And I say, until you don't want to feel good. Take them as long as you want to feel good. And that means to me till the day I die.
And it's hard for people to understand that, because, a lot of times you don't want to be on medicine forever. But I don't really look at this as medicine. I look at it as sustaining a quality of life.
Yeah, support. It's bioidentical. I don't look at them as medications. I look at them as my supplements. They supplement my aging process.
Yeah, me too.
Yeah, even though we get them from a compounding pharmacy.
Right.
Yeah. Well, thank you, Peg. It's really nice having you on, because I know how nervous you were in the beginning, and now you're very confident about your health. And it's nice to show women that just because we've had a history of breast cancer or fear of breast cancer, that maybe we should consider this instead of being afraid of it.
Right. Well, and when your book comes out, that's going to help spread the word even more.
Exactly. And thank you for bringing that up, because I'll be working on my book here coming up in a few weeks. We do have 2 more shows for you for this season. And then after that, we're going to return after the summer. So I'll be getting my book done, in May. So thank you so much for listening to the Dr. Ramsey Show today. Really appreciate you listening. Please share this with any women that you love in your life. And I look forward to seeing you next week. Thank you so much. Bye-bye.
Thank you for joining us, and stay tuned for our episode next Tuesday. Stay healthy and happy. Until next time.